How does pancreatic cyst surveillance prevent advanced pancreatic cancer? Imagine a tiny fluid-filled sac inside your pancreas that might seem harmless but could hide a serious risk. These are pancreatic cysts, and while most are benign, some types like mucinous cystic neoplasms and intraductal papillary mucinous neoplasms have the potential to turn into cancer over time. Pancreatic cancer is often diagnosed late, when it has already spread, making treatment much more difficult. That's where surveillance comes in. Pancreatic cyst surveillance involves regularly monitoring these cysts using imaging tests like magnetic resonance imaging, computed tomography scans, or endoscopic ultrasound. The goal is to spot any changes that suggest the cyst is becoming precancerous or has started to develop into early-stage cancer. Detecting these changes early is crucial because it allows doctors to intervene before the cancer spreads beyond the pancreas. When surveillance shows that a cyst is changing, such as growing in size, developing solid parts, or causing symptoms, doctors can recommend appropriate actions. These might include surgical removal of the cyst or the affected part of the pancreas. Removing a cyst at an early stage, especially when it is still confined to the pancreas, can significantly improve the chances of a successful outcome. Guidelines help doctors decide how often to check these cysts, based on their features and the patient's overall health. For example, cysts that show worrisome features or high-risk stigmata, like rapid growth or solid components, may need closer monitoring or even surgery. The key is balancing early detection with avoiding unnecessary tests or procedures. Not all cysts will become cancerous, and oversurveillance can cause anxiety and lead to unnecessary surgeries, which carry their own risks. Research continues to improve how we monitor these cysts, including exploring new blood tests and advanced imaging techniques to better predict which cysts are most likely to turn cancerous. Some minimally invasive procedures are also being studied to treat certain precancerous cysts, but these are still in the experimental stage and should only be considered within clinical trials. In essence, pancreatic cyst surveillance acts as an early warning system. It helps catch dangerous changes before they develop into advanced cancer, giving patients a better chance at successful treatment. But it's important to remember that surveillance plans should be personalized. Doctors consider the type, size, and behavior of each cyst, as well as the patient's overall health, to decide the best approach. If you have a pancreatic cyst, talking with your healthcare provider about your specific situation is essential. Following recommended guidelines and staying vigilant with regular checkups can make a real difference in protecting your pancreatic health and reducing the risk of developing advanced pancreatic cancer.